Hi, I'm Dr. John Rundback, and I have the distinct privilege today of interviewing Dr. Mahmood Razavi, who's director of the Heart and Vascular Institute at St. Joseph's Medical Center in Orange County, California.
Well, first of all, thank you for having me, and congratulations. Seems like every year you guys outdo the previous year. Great meeting, and congratulations to all of you. But our practice is a multi-specialty practice, group of interventionalists and surgeons practicing together, and our model seems to be one of those rare ones that has actually lasted.
So how many people are in your group, and are they from all specialties or predominantly interventional radiology?
No, it's actually half and half vascular surgery and interventional radiology in loose association with two groups of cardiologists.
Have you seen the vascular practice growing? Obviously, there's an epidemic of peripheral arterial disease. Have you witnessed that in your own experience?
Well, correct. You forget that I live in California and in Southern California, so lifestyles are catching up. However, yes, that is correct. There is an epidemic of peripheral vascular disease, but most importantly, they're coming to treatment. A few years ago, most peripheral arterial disease patients were ignored or misdiagnosed, but now they're diagnosed properly and they're coming to treatment.
I know that in addition to being a interventional radiologist and a well-renowned vascular interventionalist, you have a lot of other interests, and in particular, you've had an interest in innovation through startups, which not many of us have had a chance to experience. Tell me a little bit about what you've done.
Sure, but what I wanted to mostly discuss was the issue of innovation. You know, we both practice in an environment and in a field that is characterized by innovation, by new things, new therapies. It started by doing things that nobody else wanted to do or could do, had no solutions, disease entities that had no solutions, and then gradually went into areas where there was a surgical solution, and we invented new, minimally invasive, less complicated solutions with them.
Charles Dotter said that the catheter would have, umpteen potential as a surgical tool. Right.
You are absolutely correct, and he was absolutely correct. And then now we're going actually beyond localized regional diseases like occlusion or stenosis or a localized cancer into systemic therapies. And that's interesting. Treatment of congestive heart failure, for example, becoming device-based. Hypertension, metastatic disease, which, a few years ago, if you said, can you treat metastatic colorectal cancer? It was difficult. You couldn't. Now, regionally, you can approach them where the effect would be systemic. Hepatitis C. So we're going in those directions with device-based regional therapies with systemic implications, and that's very exciting for us in this field, and for those of us who keep continuously thinking on how to push the envelope, how to treat the next disease. And we're going into now the realm of drugs. So diseases and entities that were treated by drugs, now we can treat them with devices or combination therapies, which improves your efficacy that much better. So that's exciting.
Well, the most remarkable example, of course, is this idea of renal denervation to treat essential hypertension. Who could ever imagine that interventionalists and catheters would be used to treat a systemic illness like hypertension?
Exactly right, and that's just the beginning. We're going, for example, hepatitis C. You can't imagine that a device-based approach to a treatment, an infectious treatment, would have efficacy, but we're getting there.
In your own experience with your sort of startup endeavors and your business efforts, tell me, what have you found to be the barriers to innovation?
Well, there are multiple, but I like to address something that I think is important. We can talk about the financing, we can talk about the venture environment and emphasis on the late stage versus early stage. The two issues that a lot of people talk about is, number one, the regulatory environment in the US and the reimbursement environment, which at the end of the day, these innovations and these inventions, somebody needs to pay for them to have any legs on it, right? And the regulatory environment, I don't agree with most people that they say, well, US is behind Europe and elsewhere, and look, I think we're ahead of them. I think the rest of those countries are catching up in terms of tightening the regulatory environment and the ethical issues. I don't have any complaints about that, and I think we're in the right environment. Sometimes too much, sometimes too little. I think that's not the issue. The issue is the downward pressure on reimbursements. And the problem with that is that the intermediaries, such as hospitals, are squeezed. And most of them run on razor-thin margins. And so if we go by the assumption that we come up with new technology, treat diseases better or less invasively, and there's a premium for that, and somebody has to pay for that premium, the downward pressure on reimbursement has created an environment of good enough. That what we have is good enough, just bring the prices down. And that's a substantial barrier to the innovation of technologies that may, through practices of the medical device or pharmaceutical industry, usually increase efficacy translates into increased charge or premium. That environment is, those days, at least for now, are over or stopped. I feel that either the practices of the industry need to change, or that will substantially hinder these new technologies and new devices and new thoughts to come into the market because they won't be financed.
So what role do individual physicians, as compared to pharma and industry, have in validating new innovative technologies and providing a supportive environment for reimbursement?
The most important thing we have to do is properly conduct the studies that show value in what we do. And that's critical. To show that the efficacy is improved or the complication is less is important. At the end of the day, we have to show that the new technology or the new approach to a particular disease entity also has associated with it a better value for the system, for the patient, for the system, for the society.
So do you think we have in place sufficient tools for assessing the impact on society, the benefit from a cost economic analysis, and of course the role it has in actually improving patient quality of life?
We're getting there. We're getting there. The measures to look at are being better defined. The agreements across different stakeholders as to what is important. It's not just the bottom line for the payers or quality of life and longevity for those of us who treat the patients and for the patients. I think we're all coming to an agreement as to what are those important measures and metrics are for us to address to show value for the treatments that we bring.
So I know, as an aside, you have a particular interest in mixed martial arts. How long have you been doing that? And tell me a bit about it.
Yeah, since my hair was not gray, and I can tell you that as you know, those of us who are in the field that we are have a competitive personality, and if you're in the a field like mixed martial arts with a competitive personality and gray hair, those three things don't mix. It is truly the world of the young, but that's okay. It does keep me in shape and it does keep me disciplined, but it's an interesting area. It's a field that I find keeps my spirits young, and good exercise. I usually participate in a lot of the tournaments, and frequently I'm the only gray-haired guy out there. There are a lot of people who are trainers. There are people who are behind the scenes who are my age, but out in the field, there are not very many who are actually competing. But I think I've had my dose, and it's time for me to retire from that.
Do you have a competitive name or handle I can look up on the internet?
I'm not going to tell you.
So we were talking about the fact that amongst your many interests you like to climb, and you climbed Everest. And when I approached you about this, I said, should I ask you? You said it was a bit of an inglorious experience, so we won't go into detail. But what did you learn from climbing Everest, which we all would aspire to do, that you've sort of brought back to your own life? How has it affected you?
Well, I tell you, the number one lesson was that when you are faced with a physical challenge, the preparation is not just physical, it's mental. And so you have to prepare yourself not only physically, but also mentally. And I tell you, for such ultimate challenges, there are no shortcuts. So when I said it was an inglorious experience, because I took some shortcuts, and I was defeated by lack of psychological preparation, not physical preparation. I made it close. I was very close, but I had to turn back, and because I let my fears overcome the objectives. And you know something? I kick myself every day, but I will get there again.
You know, this reminds me that they say that 90% of life is showing up, and 10% or 9% is hard work, preparation, good habits, and 1% is luck. What do you think is the most important part?
Luck.
I think you're absolutely right. You should take the other things for granted, right?
That's right.
Well, you've been a marvelous sport. I
Well, thank
appreciate
you.
this. You know, it's great to have you here. We're looking forward to a very, very exciting meeting this year, and having faculty like Dr. Razavi only helps to make this better and better each year. So thank you very
Great.
much for your
Thank
time.
you.
Good.